This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning. Welcome to the Ministry of Health's virtual media conference. I am pleased to be here with today's panel of experts who will deliver an update on the Ministry's COVID-19 response. Here to provide the latest COVID-19 information and answer questions are Dr. Miriam Abdul-Richards, Principal Medical Officer, Institutions, Dr. Avery Hines, Technical Director of the Epidemiological Division at the Ministry of Health, and Mrs. Kiri Arti Homer Kimraj, Registered Dietitian with the Southwest Regional Health Authority. I am Candice Alcantara, Manager Corporate Communication at the Ministry and your moderator this morning. Dr. Richards will now present today's clinical update.
Good morning. Good morning to Ms. Alcantara, to Dr. Hines, and to our colleague who will provide an update for us. This morning, I would like to start by presenting the clinical update as per 4 p.m. on October 25th, 2020. Thus far, we have had up to date, in terms of total persons tested, 32,234. We have 4,085 total recovered patients, 1,321. 8 new positive cases, 5,511 total positive cases. In terms of death, unfortunately, we have 105 deaths and 62 persons in hospital. The persons in hospital are divided as such. There are 47 patients on the ward in the Hoover Medical and Multi-Training Facility, with 4 in ICU and 6 in HDU. At the Quora Hospital, we have 11 patients and they are all at ward level. And at the Arima General Hospital, we have 1 patient who is at ward level. At the Scarborough Regional Hospital, which is at the fort, we have 3 patients, which gives us a total of 62. In terms of our step-down facilities, at the Claxton Bay Correctional Facility, we have 23 patients. At the UE Debe facility, we have 15 patients. The remaining step-down or transition facilities have 0 patients, which gives us a total of 38 patients in step-down and transition facilities. At present, in state quarantine facilities, we have 260 patients. We also have 1,221 patients in home isolation. By 4 p.m. yesterday, we had 8 additional persons testing positive for COVID-19, with 24 persons discharged from health facilities and 43 recovered community cases. I'm also going to speak about the parallel healthcare system and the repatriation process. As you know, the parallel healthcare system was activated on the 12th of March 2020 with the first case of COVID-19. Thereafter, the parallel health system has developed from a 2-bedded unit at the Quora Hospital to currently 1,551 beds spread across 19 facilities with 3 levels of care: hospitals, step-down facilities, and quarantine facilities. In terms of the public sector, the parallel healthcare system manages all cases of COVID-19, and we also manage suspected cases and confirmed cases. Interestingly, the parallel healthcare system also provides support by quality assurance and quality control measures to the essential services, that is oil and gas. We have managed patients on offshore facilities as well. Additionally, the parallel healthcare system manages persons through a quality assurance and quality control mechanism for the diplomatic corps. The capacity of the parallel healthcare system, which is proven to be very resilient, with a maximum occupancy overall of 70% when the first cases of local transmission were detected in June, is the deciding factor for repatriation efforts. Within the last 7 days, we have repatriated approximately 240 nationals from the United States, Miami and New York, and Barbados. We intend to repatriate another further 280 patients this week, again from Miami, New York, and Barbados. The benefits of the parallel healthcare system really allow the traditional health system to continue operating uninterrupted. It also prevents the issue of infection to persons in the parallel healthcare system. There is also a high level of interoperability between the quarantine centers and the step-down centers. So, for example, the Canada Hall and Freedom Hall centers can be converted into quarantine centers or step-down centers. At present, the parallel healthcare facility covers persons from, as I said, the private sector in terms of quality assurance and quality control, the public sector in terms of ill and suspect patients, and the diplomatic corps. The critical factor in the repatriation process would really be dependent on the parallel healthcare system abilities to ensure that ill patients are being able to be hospitalized in terms of suspect cases and positive cases. The repatriation process involves a 7-day quarantine at a quarantine center, followed by a 7-day quarantine at home. This process is ongoing given the percentage of persons in the repatriation process that have tested positive over the last week. Approximately 10% of repatriates have tested positive for COVID-19. In closing, I would like to remind the public of the following. Please wear your mask. Please have social distancing measures, especially as the restrictions have been eased as of Saturday. Sanitize or wash your hands. And if you are ill, please do not go to work. Please stay at home and contact 877-WELL if you have symptoms suspected of COVID-19, such as a cough, cold, or body pains and fever. I would also like to take this opportunity to thank the healthcare workers who have worked tirelessly in our hospitals, step-down facilities, and quarantine centers. Thank you very much for this opportunity.
Thank you very much, Dr. Richards, for that reminder to follow the new normal guidelines, especially as we reopen the economy, things like wearing your mask and physical distancing. Thank you very much. We go now to Dr. Hines, who will give us some updated information on Trinidad and Tobago's COVID-19 epidemiological status.
Thank you, Ms. Alcantara. Good morning to the panel, to my colleague, Dr. Richards, and to our colleague upstairs. Good morning to members of the media and members of the viewing and listening public. Today, we're going to give the updated epidemiological situation. We have the slides to put up onto the screen, and the epi situation is as follows. As at October 25th, the epi curve updated shows the ongoing plateau of cases. We have not had cases disappear completely, but we have had them come down to a given level and hover between 30 and 40 cases, right now around 30 per day. And we are looking at the situation of decreasing those numbers, increasing the rate of decline in that new occurrence, in spite of the fact that we are encouraging additional movement and activity. So the emphasis really is now on the personal responsibility of ensuring that in each of your interactions, as we move around, we don't increase the risk of transmission and change the direction of that particular curve. We want to keep it flat and declining, so we need to ensure that our personal behaviors or personal choices are such that we don't encourage transmission. On to the next slide. The demographics that we have been describing have not changed significantly. Next slide. The cases that have been diagnosed are still, for the most part, i.e. nearly 55% in the 25 to 49 age group. That's the active working young adult age group. And again, the emphasis on reducing risk by the mask wearing, by the hygiene protocols, by staying out of the workplace if you feel unwell. Those things are going to become even more important for this age group as we have additional movement, as we have additional opportunities for individuals to congregate. The pediatric age group, that is the under 19s, we see that that bit of the pyramid is narrow. The sequestration, that's pulling aside or putting into protective custody almost the pediatric population, the kids, by not having them in school, having the remote schooling, that has succeeded in lowering the rate of infection in that lower age group. And we want to continue to protect them as time wears on. Moving on to the next slide. Among the fatalities, we have noted a continuing trend of almost a 3-to-1 ratio of men to women. So we have 75% of the fatalities among men, 25% among women, and the majority, nearly 2/3 of those deaths have been above 60 years of age, but we have had deaths in the younger age groups. We have had individuals generally displaying some sort of comorbid or pre-morbid conditions, meaning they had illnesses beforehand that would have contributed to their body not being able to respond robustly to the new infection. But again, the ongoing warning that no one is exempt from the risk of having a bad outcome. We continue to make that point, to emphasize that point, because younger individuals below the age of 60 have also had adverse outcomes. Moving on to the next slide, geographic distribution remains as it was along the most populated centers. So we see the East-West Corridor, Arima, Sangre Grande, Central Trinidad, San Fernando, but we're also seeing along the more rural roads in the River Mayaro and St. Andrew, St. David's counties that we are seeing cases. So there's no way that is COVID-free. The virus has not disappeared, and we want to continue to encourage people to take the necessary precautions even as we have raised some of the restrictions, released some of those restrictions. Final slide, just looking at the geographic distribution at sort of a heat map. So the reddest areas are the ones with the greatest concentration of cases, and as we go from red to blue, slightly less concentrated. So we do see that the city center sort of distribution around Port of Spain, around San Fernando, we have the more warm colors, those red colors that give us the understanding that there's a lot more concentrated activity there. The orange colors, again, East-West Corridor, the Sangre Grande area. What we have been seeing, though, geographically, is that as the current weeks have gone by, because this is a cumulative, meaning all the cases, map, but as the current weeks have gone by, we have started to see decreases in many of the counties. The newer cases, the last couple of weeks, we've been seeing the majority of cases occurring in 3 counties, St. George Central, and the Caroni and Nerva Mayaro. Caroni and Victoria. Nerva Mayaro has had decreasing numbers of cases, but those 3, St. George Central, Caroni, and Victoria, have had the largest numbers of new cases within the last couple of weeks. Again, related to the size of the population in these counties. But the reminder that everywhere we're expecting persons to engage in the more responsible behaviors of reducing the risk by increasing their health protection behaviors. That's what we're trying to emphasize at this point in time. As we go back into the workplace, we do want to encourage those that have returned to work, again, wear the masks while indoors, avoid the congregation within the workspace, stagger the breaks that you'll be taking so that everyone isn't in the break room at the same time. Hand hygiene of utmost importance, cleaning shared surfaces, including cleaning things like the telephone. This is not being scornful. This is not treating anyone with suspicion. We're just trying to get everyone to be as safe as possible. So if we clean the phones before and after we use them, it's not an indication of what we think of whoever used the phone last. It's just a new routine. Clean the phones, keep the doors that can be kept open so we don't have to touch them. Frequent cleaning of the surfaces in the kitchens and the bathrooms. All of these things are again going to reduce risk, and even more importantly, re-emphasizing the need not to go to the workplace if you're having any symptoms of respiratory illness, whatever they may be. If you're having symptoms of respiratory illness, you call in sick, you call out to either the hotline or your health center or the CMOH office to engage the next level of follow-up to determine what sort of infection you have. We really want to encourage that new behavior. That's probably the most important new behavior. Stay out of the workplace with any of your respiratory symptoms, and that should reduce the risk of contaminating a workplace, taking the entire workplace down, even as we begin to congregate. So with that, I'll turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines. And the doctors this morning are really reinforcing all of the new normal guidelines. Please remember them. We go now to Ms. Homer Kimraj, who will give us some dietary guidelines for those who face a higher risk as it relates to COVID-19. And I'm speaking about persons with non-communicable diseases, diabetes or high sugar as we call it, or high blood pressure or hypertension. We go to Mrs. Homer Kimraj now, please.
Good morning, Trinidad and Tobago, Ms. Alcantara, my esteemed colleagues. It is indeed a pleasure to be here. As a registered dietitian with Southwest Regional Health Authority, our aim is to provide expert quality medical nutrition therapy for persons with non-communicable diseases, as well as those with specific or special dietary needs. The onset of this pandemic has highlighted the importance of diet and the role it plays in maintaining a healthy immune function, good health, and effective management of chronic diseases. It is important to note that there is no specific food or supplement that can prevent or cure COVID-19. There is also misconception that certain foods, herbs, and supplements can boost our immune system. But remember, the immune system role is to defend our body against diseases by fighting infection. It is a system in its truest sense. It has many interconnected working parts, for example, white blood cells, the spleen, antibodies, the thymus, and the lymphatic system. These cells and organs operate in concert to hunt down and destroy dangerous pathogens such as viruses that enter your body. So a boost in that process would not be a good thing. Scientifically, it would mean that your immune system was overactive, and overactive immune systems lead to autoimmune disorders. You should instead focus on balancing your intake of nutrients from nutrient-dense foods found in the 6 Caribbean food groups. These foods have been proven to support a healthy immune function. Eat the rainbow. First slide, second slide. Choose colorful fruits and vegetables which are rich in vitamins, minerals, and antioxidants. Whole grains, high fiber staples, legumes, seeds, nuts, and healthy plant-based fats. These foods will ensure an adequate intake of important nutrients. Such diets may also support your immune system and help in reducing inflammation within the body. Next slide. Such diets, also rich in these nutrients, can also help towards maintaining overall general health as well as assist in the management of certain non-communicable diseases like diabetes, hypertension, and chronic renal failure. Next slide. Watch your intake of fats, sugar, and salt. Reducing your intake of processed foods which are excessively high in salt, saturated fats, and added sugars can also assist with effective dietary management of non-communicable diseases like diabetes and hypertension. Many people, in terms of stress, also consume a lot of processed foods, which can lead to overconsumption and excessive caloric gain. So remember to read your food label before purchase and restrict your intake of these processed foods. Next slide. Drink water regularly, staying well hydrated, mainly through drinking ample amounts of plain water, 2 to 2.5 liters for most adults living in the Caribbean, also helps our immune system. Drinking plain water instead of sugar-sweetened beverages also helps to reduce the risk of consuming too many calories and potential weight gain. Next slide. Shop smart by planning your menus in advance and by choosing locally grown foods, especially those that are currently in season. If you are on a tight food budget, it is also economical to start your own home garden to grow your own supply of fruits, vegetables, peas, and ground provisions. Remember, COVID-19 is a respiratory virus and has not been known to spread through food. To date, there is no evidence that the disease is spread through contact with food purchased. However, it is always beneficial and best to support safe food handling and preparation practices. And finally, remember that there is no one generic diet for all. So before you jump onto the next food trend or try out that new fad diet, it is important to consult with a registered dietitian who can expertly assist with your specific nutrition needs. Thank you.
Thank you very much, Mrs. Homer Kimrat. What important information for our vulnerable groups. And the next portion of today's media conference will be devoted to the question and answer segment, where we field questions from members of the media. I ask our media representatives to begin by stating your name and the name of the media house that you represent before you ask your questions. And on account of time constraints, we ask, of course, for no more than 2 brief questions, please, from media houses. We begin first with Newsday.
Good morning, all. Sri Pavel from the Newsday newspaper here. I have 3 quick questions. They can be answered either by Dr. Richards or Dr. Hines. The first one has to do with the reopening of beaches. There are some people who are of the opinion and the concern that beaches, gatherings on beaches could be seen as COVID super spreaders. Just wanted to know how you all would respond to that. And the second question has to do with the relaxation of some of the restrictions we've seen coming forward as of this week. I just wanted to know, will the Ministry of Health be doing anything differently to monitor, at least from an epidemiological standpoint, potential upsurge in cases or to effectively manage a possible increase in cases? Much thanks.
Thank you very much. And I think we'll go to Dr. Hines for the response.
Okay, thank you for the question and good morning. So the understanding that persons gathering, coming together in large groups, potentially increases the risk of spread is what we've been trying to get across to the population for the last 9 months. So yes, we do agree that if people do gather in large groups, even outdoors at the beach, that there would be an increased risk. And for that reason, as we released the restrictions on the beach, we have still continued to encourage people to go in smaller groups, to space themselves out, to look at the actual beach setting and determine whether there is space for you to take your small group and insert it into a land area that separates you from the others on the beach. If the beach is crowded, you do have the option to turn around and go back. We also do want to encourage, while you are on shore, the continued use of masks, so that we want to see some mask tan selfies coming out. We want the masks to remain in situ while you are on the shore. We do understand that you can't wear them in the water, but once you're on shore, again, reducing the risk of transmission by having the mask on is one of the measures that we do continue to encourage. We also want to discourage large limes, cookouts, that sort of thing. Really, we do know that exercise, seawater, fresh air, swimming, those things are good for you. We want to allow that access without increasing the risk. So we want to encourage some of the preventive behaviors even in that beach setting. With regard to your second question, the Ministry of Health is already fully engaged in having its responses ready. If there is any sort of upsurge, we will continue to monitor on a day-by-day basis. We will continue to keep the population apprised of trends as we have been doing in the past, and if anything changes significantly, we will be most certain to inform the population in a timely manner and to consider whatever recommendations may be needed to halt any untoward trends. So hopefully that answers both of your questions.
Thank you very much, Dr. Hines. And we go to 98.1 now, please.
Good morning to you, Ms. Alcantara, and the panel. Stephen Cummings, 98.1 FM. I have my two questions, one for Dr. Richards and the other for Dr. Hines. I'll start with Dr. Hines. Dr. Hines, there are several COVID-19 trial drugs we know that are in phase 3 with a view to looking at clinical efficacy. Could we possibly see Trinidad and Tobago being part of any solidarity trials? It is on record that there are some 13,000 patients in 500 hospitals in 30 countries on which this trial is centered. And the question comes against the background that we have also signed on to COVAX. And Dr. Richards, concerns have been raised about oxygen levels at many hospitals around the world, especially in low-resourced countries, and their ability to treat with the virus for those who may need oxygen. Are we in Trinidad and Tobago at safe oxygen levels when we look at our overall healthcare system, and more particularly our parallel healthcare system? Where do you put our local percentage levels? Thank you.
Thank you very much. And we start with Dr. Hines.
Okay, thank you for the question. As you rightly said, we are engaged or involved in that COVAX facility, but that is not a therapeutic drug facility. That is the vaccine trial and the vaccine product facility that we are currently aligned to access. Some of the international trials that we've been aware of, we've mentioned some level of engagement in. As those change, we will let you know. We have not engaged in any additional or new trials. We don't have any current plans so to do. So at this point, the focus is really more on the access to the vaccine facilities as they become available. I turn you back over to Ms. Alcantara.
And Dr. Hines responded. Dr. Richards, the second question was focused on our oxygen level in the healthcare system.
Thank you very much for that question, Mr. Cummings, which is very relevant to COVID-19. At present, we have 57 HDU beds or high dependency beds that are spread across several of our hospitals. In fact, the high dependency beds are actually spread across 5 of the 7 hospitals. And at present, today, 9 of those beds, which represent a 16% occupancy, are occupied. Over the past 3 weeks, we have seen a maximum occupancy of approximately 18%, and we have looked at a red flag or a trigger level of 80% to really look at any sorts of problems and so on. In the ICU or intensive care units, we currently have 37 beds that are activated between the Hoover Medical and Multi-Training Facility, the Arima General Hospital, the Augustus Long Hospital, and the Scarborough General Hospital in Tobago. Our Ministry of Health stock currently of ventilators is 91. Therefore, at present, we have only activated 37 of those ventilators. At today's meeting, we recognize that only 4 of those ventilators are currently in use, which represents a total ventilator use of 10%. Thank you very much.
Thank you very much. And we move now to AZP News. Just a reminder, please very brief questions. Thank you.
Hi, good morning. Priya Bihari, azbnews.com. This question is maybe to Dr. Richards. There is, you said that there is the number of people who return, 10% of them, they test positive for COVID. Is that number a sufficient number now for the parallel healthcare system to handle? And if it is, could a case be made out for the numbers to increase of nationals abroad who may want to come in? And my second question to Mrs. Homer Kimraj, can you elaborate a little more on this issue about the boosting of the immune system? Because there has been a lot of people talking online and on social media, etc., that if you boost your immune system, it's very difficult for you to contract the COVID-19. Can you just elaborate a little more on that first? Thank you.
Thank you very much, Dr. Richards. We'll take the first question.
Thank you very much, Priya. The issue of repatriation is a very topical one, especially given the Honourable Prime Minister's directive to increase the number of repatriation of returning nationals in for Trinidad and Tobago. Firstly, I must mention that the issue of approvals or exemptions to enter the country for repatriations falls under the Honourable Minister of National Security and the Ministry of National Security. The Ministry of Health is responsible for identifying quarantine arrangements and providing information on the capacity of the parallel healthcare system to support persons coming from countries such as the United States, Canada, the United Kingdom, Japan, and also India, which tend to be the countries that we are currently seeing the most repatriated nationals from. I must mention that the parallel healthcare system, in terms of its overall percentage, does not necessarily depend on a bed occupancy level. There are several other factors that would determine when a repatriation flight is due and the number of persons that a repatriation flight can accommodate. Firstly, we have to look at factors such as the social distancing and spacing on an aircraft that is coming from generally high-risk areas. We also do a risk assessment of the country of origin that persons are coming from, and in such cases where persons come from a high-risk country, such as the United States, we tend to provide containment in one particular facility. Another factor that must be taken into consideration is the airing out period for quarantine facilities. For example, if there are COVID-positive persons that are in a particular facility, those rooms are basically sanitized, or we can say decontaminated and disinfected, and also must have an airing out period of approximately 2 weeks as recommended by the WHO. We also have to consider other factors in a quarantine center, such as the turnaround time, which we put at about 3 days, to ensure that maintenance is done from a public health and engineering standpoint, as well as proper cleaning, disinfection, and sterilization. We have considered that every 7 to 10 days we are bringing repatriated nationals from high-risk countries where there are large numbers. At this point in time, we have ramped up the number of persons that are coming. So we have approximately 300 persons who are granted exemptions every 10 days. However, we must note that there are several factors that affect the ability to accommodate these patients. As such, we basically summarize and evaluate the number of persons who have exemptions to come into the country. At this particular point, we have to remember that there has been a relaxation of restrictions, and so there may be an increase in community cases. With this in mind, we have to consider the ability and resilience of the parallel healthcare system to, one, accommodate repatriated nationals from high-risk countries who may be positive, as well as positive cases that have arisen from our community transmission. Thank you very much for this question, and I hope it answers the issue of repatriated nationals.
Thank you very much, Dr. Richards. And to respond to the second question, we will start with Dr. Hines, and then we will go to Mrs. Homa Kimraj.
Okay, thank you for the question prior on the immune system and the immune boosting. One of the things that's important to remember about the immune system is that it's a system that learns from exposure. When the immune system is exposed to a given pathogen, it generates the ability to identify that thing again and to mount a rapid response to it. Now, there are some parts of the immune system, some components that are generic, meaning they can respond to just about anything. And in general, having healthy nutrition, good levels of your basic nutrients, your basic carbohydrates, proteins, fats, good levels of hydration, good levels of the recommended vitamins and minerals. All of those things will allow your body to mount a reasonable and a robust immune response because your immune system is then not compromised by dietary deficiencies. But what we don't want people to go away with is the idea that taking one particular supplement is going to protect them against the potential of infection with COVID-19. That's what we're concerned about as being a little misleading. Yes, some things may help your immune system to respond better in general, but those things do not guarantee any special protection against COVID-19, and we wouldn't want people to go away with the idea that boosting this particular supplement is going to then reduce their risk so that they take additional risks with their behaviors. So with that, I'll just turn you over to Ms. Kimraj, Homer Kimraj, sorry, to add to that.
All right, thank you for your response, Dr. Hines, for clearing up that misconception as it relates to boosting the immune system. To answer your question, Mr. Bihari, the internet offers a wide plethora of information, and they are not always verified, they are not always evidence-based, so it's always important to take what you read or see with a grain of salt. As was previously mentioned, there is no one food, supplement, or herb that can cure or prevent COVID-19 or as such cure or prevent any viral infection. What you want to do is to maintain good immune health by consuming a mixture of nutrient-dense foods from your food groups. So you want to try to eat a rainbow. What that basically means is include a wide variety of locally grown colorful fruits and vegetables, bearing in mind that each color contains a specific nutrient in the form of an antioxidant, vitamin, or mineral that can all help towards nourishing your immune health and keeping you healthy. So by reducing your intake of processed foods and incorporating more naturally grown foods, lots of fresh fruits and vegetables, you are well on your way to maintaining a good immune health. Thank you.
Thank you very much. And what a benefit to have experts here on the panel so that we don't have to depend only on information from online resources, and we can ensure that the information that we're reading we can compare to what you hear on the program today. We go now to CNC3, please.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so my two questions. The first one is for Dr. Richards. Okay, Dr. Richards, so it's like you said before, it's likely that with the reopening that we are going to see some increasing cases. And on Saturday, the Prime Minister did indicate that, we are exploring bringing home more nationals. So overall cases may increase. So what I want to find out is are the spaces in the parallel healthcare system sufficient to cope with that, or are you all looking at expanding this, getting more facilities on board? And secondly, to Dr. Hines, on that same note, as we expect that there might be some sort of rise in cases with the reopening process, and even though you all would hope that it doesn't happen, the likelihood is that it would. So what is the criteria? Where is that point at which the Ministry of Health is going to say, okay, these cases are getting too high, we need to probably look at rolling back something? I don't know if you could give me something more specific as per like a average daily caseload or something like that.
Okay, thank you, Rashad. I would speak about the ability of the parallel healthcare system to accommodate the repatriated nationals as well as those persons who have community transmission. At present, the parallel healthcare system has 1,551 beds spread across 19 facilities. Within the parallel healthcare system, we have stratified the risk level of persons across hospitals, quarantine centers for returning nationals, and step-down facilities for COVID-positive patients who have comorbidities or who may have a socioeconomic challenge in terms of the COVID-19 mitigation measures. At present, our rate limiting factor for COVID-19 is at about 70% of hospital occupancy. As you are aware, 5% of COVID-19 patients require ICU care and 15% of COVID-19 patients require HDU care. Our cutoff point in terms of the 70% has not been reached. In fact, our ICU bed capacity, even when the cases of community transmission were high, relatively, we got an occupancy of about 20%. Our HDU capacity has not gone beyond 40%. With respect to the repatriation of returning nationals, our reason is centered around the monitoring and surveillance of these repatriated nationals who have demonstrated or come from high-risk countries such as the United States and Canada. We are also concerned that these nationals may bring a different strain of the COVID-19 virus and so may have a different evolution in terms of symptoms of the virus. At present, we have a large number of quarantine spaces to accommodate repatriated nationals, somewhere in the vicinity of 600 spaces in terms of the quarantine. And of course, we are repatriating about 300 persons every 10 days, which allows for the turnaround of these facilities, especially if there are COVID positive cases or there is need for preventive maintenance. I hope this answers your question with respect to repatriated nationals and the cutoff limit in terms of when there is a danger signal or when we would really look at making adjustments for the public. Thank you.
Thank you. And Dr. Hines, I think the second question was directed to you.
Okay, thank you, Mr. Khan, for the question. Now, again, we need to emphasize that the monitoring of the trends in the epidemic is done on a daily basis. It's not a situation where we're going to take a fixed number and go, when we get to this number, we're going to make changes, but we're looking at the rate of change, how quickly we move from one level to another, or from one percentage occupancy to another, from one rate of new cases to another. So that's going to be an ongoing and dynamic evaluation. If we do see that the speed at which we are accumulating new cases, the speed at which new infections are showing up, begins to endanger our ability to manage those cases within the parallel healthcare system, then we will make the necessary adjustments. And the parallel healthcare system's capacity, as you've just been told, is also dynamic, and it's also impacted by other activities that are taking place, i.e. that repatriation process. So it's not advisable to try to stick a particular number on when we make the change, but that dynamic evaluation process goes on daily, and as the need arises, we will, of course, bring the attention of the public to the fact that we have a change in status. So I hope that answers the question you've asked.
Thank you very much, Dr. Hines. And just a reminder, I know we place a lot of emphasis on protecting yourselves while you're outside your home. But of course, a reminder, it's very important that you continue with these measures within the home. Practice hand washing. Encourage your children to wash their hands, for example. Change your towels and linen as often as possible. Restrict the number of persons that are coming into your home. Wash or sanitize your hands before you come into your home, after you've been outside in the grocery or work or anything else essential of that nature. And we go now to questions from TV6, please. I think we have Miss Cutting ready. We seem to have just a little. Are you hearing us, Miss Cutting? Okay, I think we seem to have some issue with Miss Cutting, and we will go instead to IETV and then come back to TV6. IETV, please.
Hi, good morning, everyone. Bina here from ITV. I have two quick questions. My first question is for Dr. Hines. Dr. Hines, there are currently 6 persons in ICU and 4 in the HDU. Can you give us an update as to the current recovery process in terms of what is the recovery rate for persons in such units? And my second question is for Dr. Miriam Richards or Dr. Hines. In terms of we know the update with the parallel healthcare system as it pertains to COVID. What about the other side of the healthcare system, the management of the various clinics at the various hospitals? Thank you.
Thank you very much. And I think Dr. Richards will address both questions.
So, yesterday at 4 p.m., there were 4 patients in ICU at the Couva Medical and Multi-Training Facility, and today we have 3 patients. Now, the average length of ICU stay is approximately 20 days, and that ICU stay consists basically of resuscitating the patient, providing oxygen support, and then rehabilitating that patient so that they can breathe with a face mask on their own. Yesterday we had 6 HDU patients, and amongst our facilities today we have 7 HDU patients at the Couva Medical and Multi-Training Facility, and we have 2 HDU patients at the Augustus Long Hospital. Now, the 2 high dependency or HDU patients at the Augustus Long Hospital are suspected cases of COVID-19 awaiting confirmation of their tests. The current symptoms that these persons will have is suspected of COVID-19, and given the tolerance or given the risk level for COVID-19, we have a very low threshold for admitting these patients and basically isolating them from the traditional healthcare system. The recovery time in terms of the high dependency unit is very variable. High dependency can be considered a step up or a step down level of care. So, for example, when a patient is recovering from the ICU unit after their 20 to 21 day stay, they are often transferred to the high dependency unit where they are monitored and where their oxygen therapy may be less than the ICU care. So, for example, in the high dependency unit, they are conscious. We start to rehabilitate them to start to walk. They would be starting to feed themselves or be fed with solid food, and the oxygen therapy would no longer be via an intubated airline or via a tracheostomy, but they would be taken care of with a face mask oxygen. The other way or other reason we use high dependency care is if a patient on the ward starts to deteriorate. So a patient on the ward may not require oxygen via face mask. As I said earlier, 81% or 80% of COVID patients either have mild or asymptomatic signs. Accordingly, we may hospitalize a COVID positive patient who is mild or asymptomatic if they have the comorbid or pre-existing medical conditions such as diabetes, hypertension, and any sort of lung disorder. We would basically keep such a patient in the ambulatory or at the ward level to ensure that they do not decompensate. However, in the unfortunate case of the patient decompensating, where we may notice that their oxygen levels are decreasing, we would transfer that patient in a step-up manner to the high dependency unit. So in summary, the intensive care unit and the treatment of COVID-19 patients is approximately 21 days in Trinidad and Tobago. The high dependency unit stay is a bit more variable because patients can either go to a step-up or a step-down facility. Thank you.
Thank you very much, Dr. Richards. And I just want us to put special emphasis on the elderly within our homes. I know I just spoke about protecting your home. Please, special emphasis on protecting our elderly. Wash hands even more than you would. You can set up a little sanitizer at the door, the bedroom door to the elderly person. We want to make sure that persons outside of the protective home bubble are not coming into contact with the elderlies. We want a little extra emphasis on wiping the knobs of Granny's bedroom door. We know we have some members of the elderly that are quite tech savvy, and they use that to keep in contact with other members of the family, grandchildren and the like. You want to make sure and sanitize the phones that are being used. Please let us do our part to protect ourselves both outside the home and inside the home. And we go now to questions from TTT Limited.
Hi, good morning. Sonolala from TDT Limited. Dr. Hines, home isolation. Have we seen the persons there in home isolation? Have they been adhering to everything while they are in home isolation? And is there any rate of infection to other family members? Do we have a rate of that occurring within the household?
Okay, thank you for the question. So generally the feedback from the county medical officers of health who directly supervise the home isolation process has been that the individuals in home isolation are quite compliant. They have been following the directives. They have been remaining at home and not moving around for the vast majority of them, for the most part. And in so doing, we have not really had any incidents recorded or reported of additional individuals testing positive or becoming symptomatic within the home, at least not in recent times. So the protocols that are being followed in home isolation, which include many of the things just referenced by Ms. Alcantara, the enhanced hygiene precautions inside the home, the actual tendency to ask those who are in home isolation to remain in one part of the home, preferably their own bedroom, to utilize a dedicated bathroom if possible, to have surfaces cleaned down if they have to come to a shared area, not to dine with the family but to have their meals in their rooms, that enhanced hand washing by everyone else, the wearing of a mask if you do have to come out into the common areas of the household. All of those things which we encourage individuals to do if they're home isolated seem to be working. And we'd also like to encourage individuals with respiratory symptoms that have not been diagnosed as COVID-19 but that are being felt. You're having any respiratory symptoms, even if you don't have a positive COVID-19 diagnosis, we do want to encourage you to engage in the same sort of behaviors so that you don't increase the risk of other members of your household becoming infected. So thank you.
Thank you very much. And I see that we have a question from Express newspaper. Can we go to Express at this point, please?
Hi, good morning to everyone on the panel. Kimmery Fletcher, Trinidad Express. So I have two questions this morning. I believe Dr. Hines could answer this one. Has the ministry been tracking patients who have already recovered from the virus? And have they shown any serious lingering effects of the virus, any blood clots, respiratory problems, or anything of the sorts? And also, this question is pertaining to the business community. They've responded to the latest lifting of restrictions announced by the Prime Minister, and they don't see it as positive. In fact, they see it as being too restrictive for them and believe it's going to further hurt the economy. I want to know if anyone has a response to this. Thank you.
Thank you very much, Dr. Hines.
Thank you for the questions. The follow-up of individuals who have been quote-unquote released from home isolation, those who have recovered from COVID-19, has not to date indicated any incidents of serious complications. We have set up that long COVID facility for any persons who feel that they have been having protracted, meaning drawn out or long-lasting symptoms of fatigue or breathlessness or any of the other respiratory or post-viral symptoms that people may have. And while that facility is active and available, we have not seen any of the serious sort of complications of seeing clotting events or thromboembolic events, as they're called medically, being reported to us via that facility. We continue to monitor, but that has not shown itself in our surveillance systems up to this point in time. Again, with regard to the second part of your question, without responding directly to statements being made, we just want to emphasize that the initial phase of the lifting of restrictions is really governed by a certain level of caution. We're trying to bring individuals together a little more frequently, in a little closer proximity, but at the same time still reduce risk of an explosion of viral transmission. The things that we have changed so far have basically been things that you can do while still wearing a mask at least most of the time. As we watch the changes in viral transmission, in rates of new infections, we will then be able cautiously to make any additional recommendations for further relaxation. But it would be unwise to throw too many changes into the mix at once in one fell swoop. So we are being cautious, and we do believe that while there's a balance between caution and the kickstarting of the economy, that we're maintaining the safest balance, knowing that, of course, everyone will not be immediately satisfied, but we hope to continue to protect the population to the greatest extent possible.
Thank you very much. And the last question this morning is a repeat question from CNC3. I know we have a follow-up question from Mr. Khan.
Hi, good morning again. I just want clarification on something there, Dr. Richards. You mentioned that at the when we had the community spread going on, the parallel healthcare system was never more than about 20% capacity. But if my memory serves me correctly, when we switched to home isolation on the 26th of August, it was because we basically had all the facilities filled to capacity and we were at community transmission at that point.
So the first correction is that the parallel healthcare system, the overall occupancy never crossed 70%. However, that is an overall average, and so we have to look at a disaggregated average by hospitals, also by quarantine facilities and step-down facilities. When there was community transmission, the occupancy at the quarantine facilities as well as especially the step-down facilities was extremely high. It was tending towards 80%, but the hospital levels were still quite low at about 30 to 40%, giving an overall average of about 70%. Now, at the Ministry of Health, we are concerned if we are nearing 80% on overall occupancy, and in terms of the ICU and ventilators in the ICU and HDU, our threshold is a bit lower at 70%. We moved towards home isolation for these patients because they were generally asymptomatic and well, which represents about 80% of persons with COVID-19 internationally. Additionally, the quarantine centers and the step-down facilities are interoperable and can be switched at any given point in time due to their structure, which is referred to as an alternative medical care site by the World Health Organization. So, for example, the Canada Hall and Freedom Hall at the University of the West Indies St. Augustine campus was switched to a step-down facility, given a large number of persons who were COVID positive and needed to be contained, monitored, and basically taken care of within a constricted or within a separate environment. Other facilities that we have switched in terms of interoperability are the Tacarigua Racket Center, National Racket Center, which has a capacity of about 48 persons. So in summary, the overall occupancy really represents an aggregation of percentages spread across the hospitals, the quarantine centers, and the step-down facility. The impetus to move towards home isolation was really based on the care of the well or asymptomatic patients who were occupying spaces within the parallel healthcare system within step-down facilities and within the interoperable facilities, such as Canada Hall, Freedom Hall, and the Tacarigua Racket Center. So thank you for that question, Rashad.
Thank you very much, Dr. Richards, for that clarification. And we've come to the end of this morning's press conference. As you see behind us on the backdrop, just a reminder, protect yourselves and your loved ones. Especially today, we're highlighting the elderly. Please take care of them both within the home and outside the home. Protect our children. Make sure that they're immunized. Immunization is still happening at our health centers. Everyone, please get the flu vaccine. It's free and it can protect you. And of course, wear your mask over your nose and your mouth. Do have a safe day.
COVID-19 is here and has become everywhere.